Senator Peters, thank you so much for your patience and your graciousness.
Well, thank you, Madam Chair. And all I can say is, wow. I've never been to a committee hearing like this. I haven't been around all that long, but I've been long enough to know that this doesn't normally happen here in Washington, to see so many people. All of these folks in front of me, all of these young folks, thank you for coming here to Washington. Thank you for making sure your voice is heard. Thank you for your activism. It inspires me to see this, and also shows our democracy is alive and well when we have young folks that are engaged in this. So thank you for being here. Dr. Rogers, ask my first question. And first off, I just want to say I'm grateful to JDRF for its partnership with the Elizabeth Weiser Caswell Diabetes Institute at the University of Michigan in my home state, which is improving health outcomes for people with type 1 diabetes by developing just a comprehensive understanding of type 1 diabetes metabolism in adolescents, in young adults, and as well as people with long-standing type 1 diabetes. The Institute was started by the Weiser Caswell family in Michigan, in which the father and two of his three sons were diagnosed with type 1 diabetes. And Elizabeth Caswell became absolutely relentless in her pursuit for more diabetes research, education, and treatment. The JDRF Center of Excellence at the Caswell Diabetes Institute has been identifying new ways to control diabetes and to prevent the absolute devastating consequences of diabetes, allowing them to provide better care as well as health outcomes for people with type 1 diabetes. Specifically, the University of Michigan Center of Excellence Research takes cutting-edge approaches to identifying predictive markers and therapeutic targets for type 1 diabetes complications. The Center of Excellence also studies relationships among metabolic profiles, brain function, and stress, allowing us to identify new ways to minimize the mental health burdens also associated with type 1 diabetes. So my question for you, sir, is how does the Institute at the University of Michigan rely on special diabetes program funding specifically? And what would the Institute be able to accomplish if we increase this funding?
Well, thank you, Senator. I can say that the NIDDK has really been supporting research infrastructure at the University of Michigan for quite some time. In fact, one of the original NIDDK-supported diabetes research center going back to 1977 was at the University of Michigan, and I think they've had substantial funding from that time moving forward. So it really is doing, great work. In terms of type 1 diabetes, in fact, it's doing extremely cutting-edge research. I mentioned earlier about the TrialNet involvement in developing the first drug that's FDA approved that can delay the onset of type 1 diabetes by at least 3 years. Well, one of those major sites is at the University of Michigan. And the University of Michigan is actually also very actively involved in a co-lead, in fact, the SDP-supported Diabetes Foot Consortium, which aims to study the diabetic wound healing. They also actually have a Center for Diabetes Translational Research, in which you work to develop the evidence to then put that into practice and get that implemented. And so there are many, many areas that university should be very proud of, and we're certainly proud of it. So having additional funding will allow some very bright ideas, of which I'm sure there are many, many more at that center and others to move forward. And this SDP support will allow them to sort of, get some of the things that are on the wish list moving forward much more rapidly.
Great. But good to hear. As you've talked about in some of your previous testimony, diabetes is an insidious disease that impacts folks of all age groups. And we have to be thinking about it very broadly about all of the impact that it has. So I just want to ask a quick question related to Medicare and for older adults with Medicare. Medicare will not cover nutrition therapy services for individuals. And you've talked about the importance of nutrition in your testimony. Medical nutrition therapy is not just a critical service for people with diabetes, it can also has the potential to help 88 million Americans with prediabetes. So that's why I introduced with Senator Capito, who was here earlier, the Preventing Diabetes and Medicare Act with my colleagues on the committee to extend that coverage, Medicare coverage, for medical nutrition therapy services with pre-diabetes and risk factors for developing type 2 diabetes. Real quickly, Dr. Rogers, do you believe that this coverage is essential and will actually bring down costs in the long run?
Senator, I really can't sort of either discuss or speculate, in terms of the funding of another agency. What I can say is that that we have worked with diabetes prevention program on sort of a landmark study in which we were able to show that either a medication or intensive lifestyle changes in people who have prediabetes, and that lifestyle changes included changes to their nutrition and at least 30 minutes of exercise 5 times a week, greatly reduce one's risk of going from prediabetes, this is type 2 diabetes, to diabetes by some 57%. And the study ultimately led to CMS providing coverage for people over 65 because we had included in this diabetes prevention a substantial number of individuals that could be actually looked at separately and ultimately their staff made a calculation that providing this as a benefit for people on Medicare was cost effective, even as early as 2 years. So one component of that is nutrition, but again, I can't begin to speculate on more of that.
Right. Well, thank you. Just in closing for my comments, Madam Chair, is I just again thank you for all of you being here. I think it's clear from what you've been hearing from my colleagues on this committee, we are all committed to attacking this insidious disease. We've got to stay together, be focused on it. But I want to have a hopeful message too, with all of you sitting here in front of me with your bright smiling faces, which have a great, wonderful life ahead of you. Yes, you do as well. That I think we're probably living in one of the most exciting times in human history, and what you have to look forward to in the years ahead in terms of scientific advances. I mean, we're looking at things like artificial intelligence. We're looking at synthetic biology. We've got all sorts of new technologies that are coming on board that will literally revolutionize our world in very exciting ways. And I am confident as long as we stay together, as long as we lock arms, as long as we speak with one voice, we're going to defeat this disease. We're going to have ability to treat people with diabetes, and we're going to do it together, and we will succeed. Thank you very much.
Thank you so much, Senator Peters.